want to welcome everybody to the Live Well Kalkaska Substance Free Coalition's Coffee with the Coalition Forum. And first of all, we are going to do introductions. Megan?
I'm Megan Sorensen, District Health Department number 10. I'm a public health educator for Wexford County, Kalkaska County, Massachusett County, and Crawford County.
Great. Linda?
Just unmuting myself. Hi, I'm Linda Solom. I'm with Up North Prevention. I'm their new prevention specialist. Been working a little bit with Suzanne and Tracy, and not only happy to be here, but it's also been great working with Up North Prevention and doing some tables out in the public forum and having such a positive response. So it's really, really great to be getting the word out. And people are moving around more, and they're really hungry for this type of information. So really glad to be here.
All right, thanks. Lynn?
Hi there, student. My student, Linda. Hi. I know. I look bad. So pardon. So anyway, I am the regional coordinator for Families Against Narcotics here in Grand Traverse. And so I'm trying to hop on with the coalition as I'm able. And I apologize, I'm going to have to leave here in about 20 minutes. But anyway, had some good conversations with all these ladies. Happy to start working with Tracy very soon. And thank you, Donna, for coming and telling us some new information today. We appreciate your time.
Thanks. All right, excellent. Tracy?
Well, I'm Tracy Croton, and I'm with Up North Prevention, Grand Traverse County's prevention specialist. And I'm looking forward to working with everyone, especially you, Lynn, learning everything there is to learn. So thanks.
Great. Thanks, Tracy. And I'm Suzanne Prentice. I'm the coordinator of Live Well Kalkaska Substance Free Coalition. And I am Kalkaska's prevention specialist through Up North Prevention, Catholic Human Services Up North Prevention. And last but not least is Donna Napoli, and she's going to talk to us about, let's see, her action team that's heading up a initiative for behavioral health to reduce stigma towards mental illness, substance use disorder, and she can talk about the My Thrive, right, and possibly the Shire, everything to do with that. So you can take it away, Donna.
Thanks. So I'm a health planner at District Health Department number 10. I work mostly out of the Cadillac Wexford County office, but we cover 10 counties. So Kalkaska is one of our counties. And I'm going to share my screen here. It's not letting me.
Let's try it again.
There it comes. All right. Are people seeing my slides or no?
Yes.
Okay. I'm going to put it on. All right. So as Suzanne said, we, as part of the Northwest Michigan Community Health Innovation Region. Suzanne? Hello?
Go ahead. Yeah, go ahead.
Okay. So I didn't know if somebody had a question or something. So they have got a grant from Michigan Health Endowment Fund to conduct a behavioral health initiative. And so we created some action teams to focus on different areas of that we felt needed improvement in the mental health system and substance use disorder system. And my action team, we decided to implement a mental illness awareness campaign to reduce stigma and concerns associated with receiving services. And So our action project, we're partnering. I'm the project leader, but we have a person from Great Start Collaborative. She's over in the Northeast region, but she wanted to be on our action team so that she could maybe replicate what we're doing in the Northwest region in the Northeast. We have Sarah May as the Benzie Leelanau HSCB coordinator, David Mengabeer, the Grand Traverse Community Foundation, and Stephanie Williams from Munson Healthcare. So we want to increase the public, provider, and governmental awareness of mental illness and substance misuse, and amplify some existing initiatives. So, NAMI and Munson have some initiatives, so we want to really promote those and have them focus on destigmatizing mental illness and substance use disorders. And some of the challenges with stigma are that individuals and families do hide their disorders or their mental illness and avoid treatment because of stigma-related concerns. And our goals, there's a summit that's being held, the Behavioral Health Initiative Summit. If you haven't received an invitation to that and would like to attend, just get a hold of me or Suzanne, and I can send you the link to register, but it's April 11th. So to prepare for the April 11th summit, our action team decided we would develop a community-wide survey first. So we had a baseline, so we understand people's beliefs about mental health. And we decided to just focus our survey on mental illness for this first round. Later on, we'd like to do the same thing with substance use disorders, but we decided on mental health first. And so we wanted to identify any language that cuts across stigma. So once we get the survey results, that will kind of inform us on, what the issues with stigma are, what the sectors that provide care, it's healthcare providers, law enforcement, teachers, employers, what are their beliefs about stigma, about mental illness? Are there stigma? And what can we do? So we would kind of design our trainings and our awareness campaign around what the results of the survey show. So we put the survey out, I think a week ago Monday, and it's on Facebook. We do have a flyer with a link, and I think Suzanne has sent that out. So we're asking, it's a brief 12-question survey, and the survey is going to end March 31st so that we have time to analyze the results and prepare a report for that April 11th summit. So this is kind of hard to see, but this is an update, the latest update I have on total survey responses per county. So we're quite encouraged. We have 924 responses from the counties in the Northwest Shire. And so you can see Kalkaska County, our goal was to get 0.5% of the population in each county. So our goal in Kalkaska was to get 88 survey responses, and we have 56. So we're a little short of our goal. We had hoped to get about 1,500 survey responses, but we have till the end of the week. And I haven't checked in a couple of days, so this might be a little outdated. But if you can, distribute that survey link to anybody in the community. We really want residents, healthcare providers, mental health providers, anybody really in the community that wants to take the survey. And if they do take the survey, we have a drawing for 5 $50 gift cards. So little incentive for taking the surveys. So any questions? Has anybody taken that survey? No.
I think I might have taken it.
Okay, well, good. So, as I said, you know, we plan to do a survey regarding stigma regarding substance use disorders as well. That might be one of our next future steps. I did write, there was a grant opportunity, it's a national grant from the National Association of City and County Health Officers, so it's only for local health departments. But partnering with a lot of other organizations on this grant, and it's actually, they've created a stigma assessment around substance use disorders. And so if we get that grant, we'll be able to work with the CDC on a survey for substance use disorders, and then based on the results of the survey, do an anti-stigma campaign or anti-stigma training. So that's in the works, but even if we don't get the grant, we'll do something, but might not be quite as comprehensive, but we do plan on keeping our action team going. So that's all I have about the Behavioral Health Initiative. Hopefully some of you are registered for that April 11th summit, and I don't know if any of you attended the initial meeting we had. I think it was back in November, but if you're not familiar with it, doing a lot of great things, and there is a printed document called Blueprint for Behavioral Health that has a lot of great data in it, and it's got all of the action teams initiatives and things that we're focusing on. So I can send that to Suzanne if you want to check that out as well. And so my next thing I'd like to talk to you about, I'm also staff to the MyThrive, which is a 31 county community health needs assessment. And this is the vision of MyThrive. And this is kind of our infrastructure. So you can see Kalkaska County is in this turquoise area region, the Northwest Shire region. We have a steering committee, a design team, and then we have 3 work groups, one for each region, that are kind of helping us implement. Well, they did help us. The needs assessment is implemented, and now we're working on developing a community health improvement plan. And the purpose of each work group, we're now into, they did assist us in implementation of data collection. This work group participated in assessment and ranking activities. And now the work group is focusing on the last 2 boxes, assisting with developing a collaborative community improvement plan. And then once the plan's developed, monitoring progress on that plan. So it's a plan that gets implemented and that just sits on a shelf. So we welcome new partners into the work group. So if you're interested in that, you can contact me and I can get you linked up with the meetings. And here's our timeline. You can see this has been going on since July 2020. We collected a lot of data during January through October 2021. And in December, I don't know, some of you may have participated in our event to identify and prioritize some strategic issues. And so I just, since substance use disorders is one of the priority strategic issues for the Northwest region, I thought it would be relevant to show you some of the data we did collect regarding that. So we had 4 assessments where we did collect data. We have the community health status assessment, and that's secondary data. So it's all the health indicators. We collected 100 health indicators for the 31 counties. And then we held a forces of change assessment that identified trends, factors, and events that might impact our health initiatives. We did a community themes and strengths where we collected primary data from community members and from healthcare providers. So we got some resident voice regarding some of the issues. And then the community system assessment looked at how organizations in the region work together to collaborate on health initiatives. So these are the Northwest 11 strategic issues that were identified based on the data we collected. So one was safe and affordable housing. Again, substance misuse prevention and treatment services, quality behavioral health or mental health services. Transportation was an issue. Economy, how do we foster a community where everyone feels economically secure? How do we cultivate a community that's rooted in equity and belonging? And then access to healthcare and promoting health and prevention and preventing chronic disease. The safety and well-being of community members. Of course, COVID-19 came up. And then infrastructure opportunities, that's like the built environment. Are there parks and recreation? Are there grocery stores? Are there, things in the community that help people be healthy? And then policy system, environmental changes to ensure access to healthy food. So that's the 11 strategic issues that we talked about in our prioritization meeting. And from those 11 issues, the Northwest region prioritized the top 4 issues, and that's what will be included in the community health improvement plan. Not to say that people can't work on the other issues, and we have data on the other issues, but these are the ones we will focus and make a plan on. So looking at how we ensure everyone has safe, affordable housing, the quality mental health and substance use disorder services. We kind of combined because those two strategic issues kind of tied in the vote. So we decided to link them together. So how do we increase access to quality mental health and substance use disorder services and increase resiliency and well-being for all? And then access to healthcare and reducing chronic disease rates in the region. So those are the 4 issues that we're going to focus on, and just wanted to show you guys the data briefs. And there's a link, and I will put this link, if you don't have it, in the chat box after I'm done with the slide. Oops, sorry. But you can see there's data briefs for each of the regions, and the data briefs have a navigation guide. So I'm going to stop sharing this, and I would like to show you the data brief for the substance use. So I will come back. I'm going to share the data briefs. Okay, can everybody see, should see a MyThrive 2021 Northwest data brief?
Yes, it's coming up.
Yes. What?
It is coming up, yes.
It is coming up, okay. So there's a navigation guide that kind of talks about, what these symbols and stuff mean in the guide. There's a definition of some acronyms that are used in the guide. And then if we get down to the substance misuse. So this is the strategic issue for substance misuse prevention and treatment. So some of the data we collected, you can see the survey of healthcare providers, like the 32%, so a third of healthcare providers identified substance use as a top issue impacting their patients and clients. And out of 35 issues, substance use ranked number 1. It tied with housing as a issue impacting their patients and clients. 41% said substance misuse services for patients and clients are missing in the community they served. And so for the residents, when we asked the residents what the top issue was impacting their community, almost a fourth of them said substance use was a top issue, and that ranked number 2 out of the 35 issues for residents. So you can see that ranked quite high with healthcare providers and residents in the community. The community system assessment, we met with all the collaborative body organizations in the Northwest counties. And these are some of the comments that we got from a focused conversation. So people said there's a gap in opportunity within different populations. In prevention, there's overlap with treatment and recovery. So people in treatment and recovery may be speaking out, but active users hide and are not willing to be reached. So that was an issue. They thought we needed to encourage people to engage without fear of threat to societal status. So talking about reducing stigma was important. Increasing interaction with groups such as Al-Anon, Narcotics Anonymous, AA, which continue to want to be anonymous. And then they felt there was a need for expanded substance misuse treatment opportunities. So 4 out of 10 of the community collaborative identified issues with substance misuse prevention and treatment related to stigma and inclusion. And substance misuse emerged as a top theme in 5 out of 6 of the data collection activities. You can also see with the secondary data we collected with indicators, this map just shows the highest percentages of binge drinking, and it's Benzie, Grand Traverse, and Manistee counties. They're the dark blue. Then some of the indicators related to substance misuse. You can see here, this is the indicator, and if it has an asterisk, that means in the Northwest region it was worse than the state average. And so you can see there's opioid-related hospitalizations, drug-induced mortality. The alcohol-induced mortality was worse in the Northwest than the state. And then in the forces of change assessment, participants said we need to stop the silos of care. Again, stigma of receiving treatment came up. And then the limited availability and high cost of receiving treatment. So that's the data from the region. So that's all the 10 counties in the Northwest, but includes Kalkaska. And then I am going to stop sharing this again. And we also have local data. We're trying to get the local data broken out so each county has their own data. And that will be available on, we're hoping to get it on a website and available to everybody by April 1st. So we'll let you know where that data is. And I think that'll be useful if you're working at the county level rather than the regional. And I can walk you through an example of Kalkaska's here. All right, so does everybody see this? Is it hard to see? Or so this is the local, what?
It's hard to read a little bit. It's a little small, but if you walk through
it. Well, this is just to kind of show you what it's going to look like. But this is Kalkaska. It talks about each of the assessments and how many people participated. And then this is this page with the all the indicators, the secondary data. So this is all the Kalkaska indicators, and you can see the 100 indicators here. When you get down to a lot of the, unfortunately, with the small population in Kalkaska, a lot of the data related to substance use, there's not enough response to make it statistically significant at the county level. But if there's one, I think the opioid-related hospitalizations, and then the rate of, and then the, I think there's the, oh yeah, the drug-induced mortality rate is available for Kalkaska. Right now, it's saying it's lower than the state, but this is, I think this is 2019 rates. So we're finding that now there's new data coming out for 2020 since we collected this, and we're seeing that a lot of the rates are going up. So,
and a lot of the people, as far as drug-induced mortality, they're over in Grand Traverse. A lot of our people end up over in Grand Traverse, and I believe they include it in Grand Traverse rates.
oh, really? Oh,
I think that's what I was told. Yeah, so if you have somebody that lives in Kalkaska that ends up passing in Grand Traverse, it's included in Grand Traverse. And a lot of our people go over to Grand Traverse.
yeah, so that's kind of misleading there. Yeah.
Yeah, I'll have to make sure. I wish Tim Hudson was on because he could tell us, he knows more about that.
Yeah. These are the sources of the data. So if you want to use any of those indicators or data, you can look up the sources here so that you can cite the sources.
Can you send this all to me, Donna?
Yeah, once it gets available, this is just a draft. It's not quite done yet, but it will be available April 1st. That's our goal.
This is all good information and helps me.
Yeah. And this is from the community system assessment regarding the data. So the collaborative and Antrim Kalkaska Collaborative said resources was the most important area to focus on. This is the aging, the community themes and strengths. So they asked people, this was a pulse survey, so clients were asked, my community is a good place to age. So you can see they had, what, 5, 9, 10, 12, about 15 people answer in the aging category. And people mostly agreed or strongly agreed. We also had a category for children. Is it a good place to raise your children? That didn't get such a good response. And then people with disabilities, we asked if in this community, can a person with disability live a full life? And people pretty much agreed they could in Kalkaska. And then we also asked if there was economic opportunity in the community, and that was kind of split between mostly disagree, but strongly agree, about half and half. So, and then we asked in the community survey of residents and healthcare providers, I think this is the residents one, but we asked about, this is the demographics. Okay, here's where we asked the question. So we asked, what's the most important factor for a thriving community? And you can see in the bar graphs, it's hard to see on this slide, but when you get the actual data, you'll be able to see what people thought was most important for a thriving community. And then they also asked what the most important issue, what the most important problem was in the community. So that data is there for community residents, and it's also there for the healthcare providers. We asked the same questions.
Yep. What was that? Housing and substance use? And that last one were the two top. Which
I don't know. I can't see well enough. It's too small for me. But
a lot of times those two go hand in hand.
They do. And well, that's were the top two issues that were prioritized in the event for the region. So I'm thinking that probably is correct.
Mm-hmm.
So anyways, just to give you a flavor of, the kind of data we have, and that, we hope you guys use it.
Absolutely. Yeah, when it's ready, send it to me.
Yeah, I will. And then I'm going to go back to my slides for just a second here. Oops, sorry. Shoot, I closed myself out. Sorry about that.
Take your time.
I will get it back. Oh. Sorry about this. I'm clicking too many times here. All right.
When do you find out if you guys get that grant?
It's a quick turnaround. We're going to know April 8th.
Okay, cool.
So, but it's kind of a long shot because it is a national, it's competing against every state in the United States, and they're only going to select 5 people. So it's kind of a long shot, but we thought we needed to try it anyways.
Absolutely. You never know.
So the last thing I wanted to let you know is we are going to have a summit, a local data tour where we roll out that local data that I was showing you.
Okay.
So I will send this out too. We just got this registration form today. So May 6th is the Manistee location. May 13th is at Big Rapids, and June 3rd is in Grayling. So there'll be 3 events with the lunch, and so register for that and distribute to people.
Yeah. So June 3rd would be probably the one I'd go to.
And then just to go on from MyThrive, once we've collected the data, like I said, we want to develop a community health improvement plan. So we're looking at, to do that, we're going to take each strategic issue and we want to know what work we want to do an environmental scan. So what work is already happening in your community, who's leading the work, and how can we support existing work? Because we don't want to have a plan and create all new strategies and things going on if there's people already working on things. That doesn't make sense to recreate the wheel. So the more we can learn what's already going on and put it in the plan so that people know about what's going on across the region and people can have a chance to better support each other and collaborate. That's our goal. And then we want to develop then looking at evidence-based strategy ideas and then looking at the county level data. So those are the things we're going to use to decide what goes in the plan. And so right now I would like to do, if you guys are up for it, I have a little interactive easy retro board. And you guys can kind of let me know. I'm going to try to do an environmental scan of what you guys have going on. So I'm going to share that. And I'm going to put this link to the retro board into the chat box. Chat. I can get to it. Right. All right. So you should see a link in the chat box that you can copy and paste into your browser. If it doesn't work, to just click on it.
Okay. You want us to do that now?
Mm-hmm. So is everybody seeing the Live Well Substance Free Kalkaska Strategy Inventory? And it should say Easy Retro.
I see the easy retro. Yep, I
Yep.
see it.
Okay. So when you click on, so there's a question at the top, how do we increase access to quality mental health and substance use disorder services? So that's the strategic issue we're focusing on. And if you can let me know, like, what's going on, what are you guys doing in Kalkaska to address that strategic issue? And if you click on that little plus sign underneath the question, you can write your answers in the little box that comes up.
So you want to know what we're doing currently?
Yeah. Are you,
Okay.
yeah. What in Kalkaska County is going on that addresses
We have
increasing quality substance use disorders?
what is it? Life's Work Clinic is offering counseling in MAT.
So are you able to click on that little plus and write it in the box?
Shoot. It's not. I don't know.
Give everybody a couple minutes to write their answers down. Somebody said more available resources. I think that's a need. So in Grand Traverse, you're providing education for the public as well as the Grand Traverse jail training. What kind of training are you doing in the jail?
We're doing it actually, we did last week and this week, and it's a messaging training.
Oh, okay.
So it's like helping remove stigma of addiction and mental illness, learning to communicate, providing resources, and any other questions they may have. We have training yet today, which I'll be leaving here for in a little bit. So it's very exciting.
Oh, that's awesome. Yeah, that's awesome.
That's in Grand Traverse County though, right?
Right. Mm-hmm.
Is that a special training that, who's doing the training, or what's it developed by?
Well, the Grand Traverse County, the jail staff have core training. So their training is actually all day. But we were invited to come over. We get about an hour and a half at least. And Laura Conrad will be there. She's the one doing the speaking of the messaging training. So, and then Corey Winfield will be there too today. So.
Awesome.
And then
That's
there, you know, we talked to him after the training last week, and he's very, Lieutenant Jimmy Argyle, he's very open to having more trainings, just a matter of trying to figure out the when and how we can get that going on.
Mhm.
So
That's encouraging. Good.
it really is. I mean,
Yeah.
to me, it's really encouraging that they are wanting to learn, which is a huge, huge step for Grand
Yep.
Traverse. I've seen a lot with, you know, with the stigma, and I understand, I get it, you know, so, but at the same time, I think if they were given the opportunity to have the training or the knowledge, the education, talking with others that have dealt with addiction, mental health, they would understand. They would have a little bit more compassion, be more open to other trainings. So I know they're doing, or they have done the crisis and action training, I think it is. So they're doing a lot of different things. So not just with us, but with other people as well. I'm just anxious to kind of learn about what other things are going on with other programs.
Very good. It says Grand Traverse County is also offering prevention education, naloxone training to educators, and take back day of prescription drugs. Life's Work Clinic offers MOUD and counseling. Remind me again, what's the acronym MOUD?
Medications for opioid use disorder.
Disorder. Okay.
Yeah, instead of MAT, that's the one that they're going with.
Yep.
I'm still going.
Where's Life's Work Clinic? Is that?
That's Adam Devaney is the counselor over there. It's right by the post office.
Is it in Kalkaska or Grand Traverse?
Yes, it's in Kalkaska.
Kalkaska? Oh, okay.
Okay, let's see.
And then Liberal Kalkaska Substance Free Coalition is offering community ACEs training. Law enforcement and inmates training currently scheduled. Very good.
It's hard to put this stuff in here. It won't let me click on it real easy. Can I just tell it?
Yeah.
Yeah, it would be easier. So we have our comeback sacks that include naloxone and personal hygiene products that the sheriff hands out to individuals with a known substance use disorder when they're leaving incarceration. We offer naloxone to the community. In fact, I just ordered 109 naloxone kits from MDHHS for both the comeback sacks and for the community. Of course, we have this, if we can get more people on it, the Coffee with the Coalition, if we can get more community members involved so they can learn a little bit more about substance use disorder and the things that pertain to it. What else are we doing? We're in the schools. We're going to be offering a positive, what would you call it? It's a group that's coming into the high school next year. It's Michigan Youth Alive. And we're going to be offering that to the high school, middle school, and elementary schools next year. It's just kind of a positive group that reinforces, self-esteem and, positive choices. A lot of stuff going on. Everybody still there?
Yep.
Okay.
Trying to type it in.
Okay.
I wasn't sure I captured what you said. Did I get it right? I didn't know what you called
Oh, the comeback sex. Yeah, I kind of have it on.
Comeback
Yeah.
sex.
Yeah,
Oh,
I have
okay.
it like up above that. Offered naloxone personal hygiene products to individuals leaving incarcerations. Yeah, it's called
Oh,
comeback.
okay, that's the same thing. Okay.
Yeah, comeback sex. But
And then what was
Yeah.
the name of what you were doing in the schools? didn't-
we're currently going to be signing a contract with Michigan Youth Alive,
Oh, okay.
and we'll be bringing that to the high school, middle school, and elementary schools.
Cool.
And I need to contact Forest area because they always get left out. I know I think their elementary school is actually in Grand Traverse County, but their middle school and high school is in Kalkaska County. And I'm trying to get my foot in the door. That's where my son went to school. So my youngest son. I'd like to see what we can do there.
Okay.
So
Anything else? That's a lot you guys are doing.
yeah, I'm sure that, through Families Against Narcotics, they have an initiative that's called Stronger Together, and that is a family support group. And so we have Stronger Together Kalkaska. Right now it's covering both Kalkaska and Grand Traverse County. Grand Traverse had their own group, and the person that was running that had to leave. So we've been offering it to both counties. I think eventually Grand Traverse will have their own group as well. Now anybody can show up to any group, it doesn't matter. But so we have that family support group that we do every other Tuesday night for about an hour and a half, and it just helps family members that have a loved one with substance use disorder to help kind of navigate this journey that they're on.
Mm-hmm.
So I don't know. I'm sure there's more.
Yeah, there's also the NAMI that has the family support group for mental illness
health.
and Traverse. Yeah.
Yeah. Yeah, and I never could understand why, if substance use disorder is a brain disorder, why isn't it under mental health?
Yeah.
Because they should be. I mean, it is, and certain insurance companies consider it the same. When you go to get coverage to go into, inpatient or outpatient treatment for substance use disorder, that's under your mental health, policy.
Mm-hmm.
Correct? Typically.
Yeah, I'm not sure, but I know there's a lot of, I can kind of,
with TRICARE.
there's a lot of things related to stigma, I think, that people try to separate it, but, it is they're both actually, brain disorders. And
right, exactly. And they almost always, co-occur, so.
That's why I hate when they call it behavioral health, because it's like, it's not a behavior, it's a physical, physical
Their
disease
condition.
of the brain, and
Yeah.
And the brain's part of your body. So,
It really shouldn't be separated.
Separating it physical and mental health kind of like, isn't the brain an organ of the body too? So,
Right. Probably one of the most important.
Yeah. Yeah, we got a lot of work with stigma, I'll tell you.
Right. So I had heard, and I don't know if it's still being planned, when Kalkaska Memorial Health Center, they have been expanding, and I know that there's a mental health clinic there, and I know that they were talking about expanding this substance use disorder. I don't think they have as yet. COVID, I'm sure, has slowed that down. So
Right.
a lot of mine.
Well, thank you guys and I will send this slide deck to you, Suzanne, if you want to send it
Okay.
out.
Yep, whatever you send to me, I'll send out to the coalition.
Okay.
And Linda, I think I need to get you on the coalition email page. That might be why you're not getting the link. So. All right. Does anybody have any questions for Donna? Any at all?
I'll also send you, Suzanne, our Northwest work group meets, I think it's it's always the third Tuesday, or actually it's always the fourth Tuesday of the month.
Yeah, that's what
And it
time?
meets from 10:30 to 12, I think.
Yeah, and that's probably where my problem. That's probably where my problem is. Is this Coffee with the Coalition is always the last Tuesday of the month from 11.
Oh, okay.
Well, yeah, so
But
that's where
yeah, if people want to get involved with, the community health improvement plan, we really need your voice so that we capture everything that's going on, and this really helped today.